Our teaching today is on antenatal care. What do we mean by antenatal care? Are you pregnant? You need care. Why does a pregnant woman need care? Care from who? What kind of care? What is the aim of antenatal care? What are the reasons to render care to a pregnant woman? One, antenatal care is that care which is rendered by trained personnel, be them nurses, midwives, doctors, whatever. They should be trained. And this care is rendered to pregnant women and their families using certain activities which we will discuss. We will understand those activities that are carried out on the pregnant woman in the hospital. And our interest is for us to better understand the importance of antenatal care. When you know the role of even the health personnel on you, the pregnant woman, you will not fail to attend antenatal care or antenatal clinic. Now, we shall take a separate video only to study the main activities that are carried out on the pregnant woman in the hospital, where we call the clinic. When the pregnant woman, when somebody discovers that she's pregnant and goes to the hospital, what is it that is done on you? Can you put it down? Can you really explain what the health workers do to you? What are the activities that they carry out to ensure that you are healthy as a pregnant woman and that your baby is developing well in your womb? Before we go to that, let's tackle the aims or the reasons or the importance of care to a pregnant woman and her family. One, the pregnant woman needs to go to clinic because clinic care is aimed at one, confirming that she's pregnant and ensuring that her pregnancy is well formed and developing well, and ensuring that she is not carrying an abnormal baby, and be sure that she's not carrying a baby that's grossly malformed, that she's not carrying a baby that is going to come out with severe congenital problems, malformations. Okay, that can be determined in the clinic, which is one of the main aims for you to go to clinic. Are you seeing the baby in your womb? My dear sister, when you discover that you are pregnant, you have to go to hospital and request, say that you are coming to start your antenatal care. And then the hospital will pick it up from there because it is of great importance. Number two, they need to determine the age of your pregnancy and determine when you are going to give birth. Then your care is going to continue. While they will be carrying out your care, a lot of investigations will be done in the course of your care, which we shall discuss them all under the activities carried out in the clinic. What are the importance of antenatal clinic? Why do you have to carry your pregnancy to hospital? When it is said that pregnancy is not a disease, everyone understands that pregnancy is not a disease. But we also said that pregnancy brings a lot of changes into the system of a pregnant woman. Pregnancy has hormones like estrogen, like progesterone, what we actually refer to as human chorionic gonadotropins. They circulate in blood and they affect all the systems in the human body. And so some women react differently to these hormones. The progesterone relaxes smooth muscles all over the body, not only in the womb, which favors the development, the formation and growth of a baby. And now the growth of the tissues of the baby is now favored or facilitated by another hormone we call estrogen. Ladies and gentlemen, when a pregnancy is implanted in the womb of a woman, one of the first organs that is formed is the placenta. And then the placenta starts secreting hormones that will sustain the pregnancy, hormones that will preserve the pregnancy. And this particular specific hormone, estrogen, progesterone, they are so important for the growth and development of the fetus, of the baby, of the pregnancy. Once the levels of these hormones drop, if they are inadequate, then you are bound to lose the pregnancy. God forbid a woman gets pregnant and then suddenly loses it from a problem that could easily be discovered in the hospital and solved. Some people have spontaneous abortion, meaning that they just notice that they start having some pain, they start bleeding, and then the pregnancy is off. Oh, they cry. Sometimes it was just because of maybe low levels of progesterone. And then the system cannot relax enough because it needs peace. It needs the tissues to be soft, for growth to take place. Once the levels of progesterone drop, there's bound to be uterine contraction that may jar, that may disturb the formation of the baby, and that may cause the separation, the detachment of the placenta that is attached to the wall of the woman, and that is how you may lose the pregnancy. Thank God, nature makes it that a lot of women, once they're pregnant, the estrogen and progesterone are at balanced level, and they enhance and preserve the pregnancy. Now, why should the woman go to clinic? One, to promote her health mentally and physically. They are going to give her a lot of education. They will teach her a lot of things relating to pregnancy. They are going to examine her. They are going to see any complaint on her, and they will educate her on it. They are going to ensure that she is fine. Just to look good, they will teach you in the clinic what it takes to look good as a pregnant woman. Hygiene of the mind is about education. What you don't know, they will let you know it in the hospital so that your mind can be very clean and you feel satisfied and there's no fear of the unknown. There's no anxiety. So you cannot easily go into depression. A lot of such psychological trauma in somebody who is pregnant is because of lack of knowledge, inadequate knowledge. But the people are trained in the hospital to receive you pregnant women and teach you what pregnancy is, teach you how pregnancy grows, teach you how labor will come, and so on. Number two, you have to go to clinic because they have to detect early and treat any disease. If you are suffering from any infection, when you come to hospital, there's a way they screen for it, and if they discover any disease, they treat it quick, early, so that they can avoid complications on you and even on the growing fetus. No, they will prepare you for breastfeeding. That's number three. Preparation of the pregnant woman for breastfeeding. Because the baby growing in your womb will come out one day. You will give birth and you will need to feed the baby. It takes the breast to feed the baby. Do you know how to take care of your breast? Do you know how to treat the breast so that when you give birth to the baby can suck vigorously without cracks, without wounds, without pains? It is possible. Come to the clinic and they will teach you how to treat your breast during pregnancy. They'll teach you even how your partner, your husband, can help you to keep your breast healthy. Okay, that is why antenatal care is not only care to the pregnant woman, but it is to the pregnant woman and her family. First, we plead that the pregnant woman should always go to the clinic with her partner. Are you the husband? Are you the boyfriend? In fact, are you the one who got her pregnant? Excuse me. It is important to go with this woman because she needs your support. Both of you need the knowledge they are going to provide at the level of the clinic. When you both have this knowledge, it will help you people to care for yourself, care for the baby, and then care for your family. Now, number 4, they prepare you for labor. When you are pregnant, you will give birth someday. Do you know what it means, labor? We will take some other video to teach labor and teach you how to cope with labor. But these are lessons. You go to the clinic, they teach you what labor is, teach you the science of labor, teach you how to cope with the process of labor. In fact, we can teach you such that you can go through labor process until you give birth without crying. It's possible, yes. If you doubt that, you can get to me, and I will teach you and prepare you how to bear labor pain without crying. Because some people believe that you cannot give birth, you cannot go through the process of labor without shouting. No, we can teach you. It is simple. There's something about uterine contraction. There's something about this pain in labor that comes on and off. You know, when we teach our pregnant women, we normally describe the coming of the contractions comes on and grip like strong cramp. And so start going back and relax and you feel free. We normally describe it as mwing, mwang. Okay? Yes. And the pregnant woman tell you that when it came mwing, she saw stars. And then it just began to go mwang, and then her eyes got clear again. Yes. When it starts coming on and off, this intermittent uterine contraction, this is what makes true labor. We shall teach you that when the time comes. We can tell you how to cope with that, because we can teach you how long a uterine contraction lasts. So that when it starts, you can even be imagining and counting the number of seconds in your mind. Before you know it has gone off without you saying, Yes. I'll take some video to teach specifically on how to cope. This is one of the things the women are trained in the clinic. In fact, this video, as I said, is aimed at empowering both the women, pregnant women, the men, the workers, healthcare providers, all. Number 5, importance of attending antenatal clinic. My dear, to ensure that your baby is growing in the womb. You go to the hospital, they will examine you to find out if your baby is growing in the womb, if the baby is growing normally, if the baby is growing according to the age of the pregnancy. There are many ways they do that. And one of the aims, number 6, was this number 6? They demonstrate how to make a balanced diet. A lot of us have food, we do not know how to put a combination together. Sometimes they do even demonstrations at the level of the clinic to the women, to the men. Tell you that if in your community, your favorite food is achu, okay, like in my village, achu, maybe yellow soup, okay, they will tell you how to add obstacles. What my people call obstacles, the meat can go there, fish can go there, jakatu, what they call jakatu in my village is garden egg, okay, garden egg. They could add egusi, they could add huckleberry. Huckleberry is vegetables. In fact, they can show you how to make that achu to be very, very enjoyable, so that somebody even just listening to me begin to water in the mouth, hunger to eat some of that achu with a lot of complementation. But you see, some people just pound this achu. Some people just pound the pounded yam. Some people just pound the cocoyam. Some people just pound whatever fufu, and they eat with soup that has no quality. The baby may not be developing well within you because it doesn't have the raw material to build the baby well. So it is good for your woman to go to clinic. Go to clinic. The people training you in the clinic will demonstrate how to make your food. Is it fufu corn and jamanjama that you people eat? What they call jamanjama is huckleberry. It's a vegetable. How do you make it up so that you eat your fufu corn with jamanjama and it is rich in all food nutrients? What can you add to it and so on? Go to clinic. In your area, even the health workers working in your village, they understand the kind of feeding pattern of the people in that community, and they can help you how to use it, but make it. This is the importance of going to clinic. Remember, they will give you vaccines in the clinic, like the vaccines against diphtheria, against tetanus. You will see that these days, babies, you don't hear of newborn babies that are born and they easily contract tetanus. No, because the mothers are sensitized during pregnancy. They give them vaccines that sensitize their bodies, and their bodies prepare antibodies that already the baby in the womb gains from this immunity before it's being born, before they continue to vaccinate the baby. This is good. If you're not attending the clinic, you stand a great risk. They do a lot of preventive management during pregnancy. Go to the clinic. I am just begging you. Please, understand your vaccination calendar for everything. They do preventive medicine. Some, they give you preventive drugs, maybe against malaria. They give you blood tonics, supplements to prevent anemia, because we know that the blood of the pregnant woman is always like diluted, a lot of fluid accumulates, and then there's less hemoglobin. And they need to show you how to continue to build this. If you love this video, subscribe. As I said, my name is Dr. David Ayin. I am a reproductive health expert. And don't forget, you can write to me, you can make your comment. You can write to me on 674-605469. If you are not in Cameroon, you start with +237 and you add that number. Thank you.